Okay.
Here is your station. All right. So if you've read and understood, considering that history taking station, please begin.
Hello? Hello?
Hello?
Yes, I'm Dr. Mahir, one of the exam candidates here. Can I confirm your name and age, please?
Yes, my name is Sarah and I'm 67-year-old.
Okay, nice to meet you, Sarah. Can I call you Mrs. Sarah?
Yes, yes.
Okay, nice to meet you, Mrs. Sarah. Could you please um, uh, tell me, is that okay? I will ask you a few questions regarding your health, and I will write down while asking you. Is that okay with you?
Yes, yes.
Okay, could you please tell me what seems to be the problem today?
Yes, doctor. Today I falling down and all my body shake.
I'm very sorry to hear that. Could you please tell me more about this?
Yes, doctor. This is started in the 1 year ago, and I falling down. I lost my consciousness, doctor.
Okay, I'm very sorry to hear this. Could you please tell me about the episode that happened today? When and where was it happen?
Yeah, I was in my work in the office while I'm sitting in the chair.
Okay, and yes, do you have any warning sign before that? Like you see any flashes flight or any abnormal odor or any feeling
Yeah, yeah, yeah.
sensation?
Hmm. I
Yeah,
see
what is
some flash of lights. Yes, something like this.
okay? And did anyone witness this episode or attack?
Yes, my partner in the work.
Okay, and did you lose your consciousness?
Yes, yes.
For how long did you lose your consciousness?
I think 15 minutes.
Okay, and did you fall down?
Yes, yes, doctor.
Did you hit your head or something like that?
No, no, no.
And what your partner who witnessed this attack told you? Is it all your body shaking or part of your body?
Yes, all part of the body are shaking.
Okay. And did you bite your tongue or did you like injure your lips or something like that?
No, no, no. I'm just wetting myself.
And did she told you that your eyes have been rolling up or something like that?
No, no.
And when you regain your consciousness, did you find that you lose your control over poo or pee?
Yes, yes. I wet on myself.
Okay. And I'm very sorry to hear that. And could you please tell me, do you have any weight loss or loss of appetite?
No, 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 doctor.
Okay. And do you have any problem in water work or bowel work?
No, no.
Any change in vision?
No, no.
Do you have any vomiting?
No, doctor.
And Can you please tell me, do you have any night fever or night sweat?
No, no,
Any fever?
no, no,
Any neck stiffness?
no, doctor.
Any light sensitivity?
No, no,
And is it, do you have any history of trauma before?
no, no.
And you told me that it happens before, right?
Yes.
When was the first attack?
1.5 year.
Okay, and could you please tell me, is it similar to this one, or is there is any difference?
Yeah, similar.
Okay, and going back to your episode today, did you, after regaining consciousness, do you feel any headache, or you feel unable to speak, or any body ache like that?
Just weakness. I feel some weakness in my body.
Okay, and could you please tell me, do you have any previous medical condition?
Yes, I have high blood glucose and high blood pressure.
And what you are taking for this high blood glucose?
Yes,
What
I
medication?
take metformins, and I will take for hypertension. I take amlodipine.
Okay. And do you have any other medical condition or any other brain
No, no,
surgery or problem?
no, no, no,
Okay. Did you take any other medication for a long time?
no, no,
Do you have allergy for any medication?
no.
Would you mind if I ask you some personal question?
Yeah, go ahead.
What do you do for a living? What do you do for a living?
Yes, I'm housewife.
Okay, can you summarize your history now, please?
Today I took history from Mrs. Sarah, 67-year-old
Yes,
housewife. She's non-diabetic, for which she's taking metformin, and she's non-hypertensive, for which she's taking amlodipine.
yes,
She had an episode of convulsion
yes,
that happened at work. She have a warning sign before, like she see flashes of light. This episode is witnessed by her partner, and they told her that she lost consciousness about 5 minutes, 15 minutes. She have generalized convulsion with loss of sphincteric control, and there is post-ictal weakness. Her first attack is 1.5 year ago. As per her age and her symptoms, my provisional diagnosis is like any space occupying lesion, which could be
okay,
a tumor, like a primary or secondary tumor.
yes,
And I would also
primary,
consider, yeah, I would also
yes,
consider epilepsy as a cause,
yes,
meningitis or
yes,
encephalitis,
good.
and also I would consider hypoglycemia and electrolyte disturbance.
Okay, what investigations would you ask for to confirm your diagnosis?
Yeah, first, if time would allow me, I would complete my history by asking about completing the social history, asking about idea, concern, and expectation,
Good,
and also asking about the systemic review.
yes,
For investigation, I could do request full blood count, urea and electrolytes, especially calcium, sodium, and magnesium. Also, I will request blood glucose and arterial blood gases. I will also do an EEG or CT scan or
yes,
MRI of the brain.
yes,
Yes. And I may do lumbar puncture if I am suspecting meningitis or encephalitis.
yes, and if it allows as well. All right, can you tell me about the treatment that you can offer to this lady?
First, if she's convulsing, I will try to move her away from any harming objects, and I
Yes,
would put her on the lateral position and observe her. If there is status epilepticus, then I will give diazepam 10 to 20 milligram IV.
and
And if she's in the post-ictal state, I will give some medication to prevent recurrence. Like I can give benzodiazepines phenytoin, phenobarbital, and I may give also sodium valproate. If my diagnosis confirmed like being intracranial tumor, then I would go to do stereotactic biopsy. And if it is resectable, I would do resection, or otherwise, I would do debulking of the tumor using gamma knife. I will discuss all of this in MDT meeting with a neurosurgeon and oncologist.
First, you'll discuss with them with MDT, and then you'll do all this management. Surgical.
Yes.
Okay. So
Sure.
this is how it should be. Good. Thank you.